Hi, my name is Rebecca Hayes and I've just finished a 7-week soft tissue occupational therapy placement, and I'm going to answer a challenging question with regards to my case study, and that is, how could I have made my treatment program more occupationally focused? So there is limited literature about soft tissue occupational therapy, and in particular with regards to my question. So I feel it's an important topic to be addressed by the academic OT community if soft tissue OT's valuable contribution is to be recognised by the OT professional community. So my client is Michelle. She's a 56-year-old mother of 2 adult children and wife. So she also values highly altruism, and she expresses this through her membership with a voluntary organisation that assists refugees to integrate into Perth. So Michelle's productivity occupation is that of a bookkeeper for her family business, and she has a highly supportive husband who has been a large enabler in her rehabilitation process. Michelle sustained whiplash on the 1st of May 2013, and she was referred by her GP for physiotherapy. After a course of physio, she felt that she needed something to work deeper into her muscles, and so the GP referred her to our clinic, and we began a course of 15 sessions. So in order to answer my question, I will look towards the PEO framework. During the sessions, we educated Michelle on safe manual handling techniques, but we were not able to use objects that Michelle regularly uses in her daily activities. These examples might be lifting shopping bags out of a car or how to paint a house safely using ergonomic techniques. This is something that she does with the refugees to help them renovate their house. So it may have been viable actually to ask Michelle to bring some shopping bags, come to her appointment directly after shopping, so that we could assist her with lifting techniques. However, the culture of the workplace is very much soft tissue OT focused, and it would be hard for a student to come in and try and suggest something like this when it goes against the norm of the workplace. So going to the shops or to her home to assist Michelle with techniques to improve her ergonomics and lifting would not be viable because the clinic doesn't offer external services. And the practice context represents a challenge in making the therapy more occupationally focused, in that the treatment rooms are very small, so there's not a lot of room to move around and be creative. And there's no scope to use the kitchen because it's reserved for the therapists. The appointment times are limited to 30 minutes, which doesn't leave a lot of time to be creative and tailor to the client's occupational needs. And also the insurance is covering for soft tissue OT, and this treatment is focused on improving the circulation to the muscles to rid the body of the waste products. It's also aiming to break down adhesions or scar tissue which form in injured muscles, so that the muscle may lengthen, relax and reduce the stress on the joints, and to reduce tension and pain and headaches. So on completion of this treatment, there is not a lot of time to go about doing other occupationally focused interventions. The insurance company provided approval for an ergonomic assessment, and this was done by our clinic as part of the plan for Michelle. This is an area which I guess is more occupationally focused, because an OT from the clinic came to Michelle's workplace and assessed her workstation and provided ideas for improvements, and also provided recommendations on ergonomic office products that were covered by her motor vehicle insurance. Although I didn't refer Michelle to the ILC, this service would have been able to assist Michelle in providing cooking utensils to improve function and reduce pain and prevent further injury during her necessary and also leisure occupation of cooking and entertaining. So this would have been a valuable addition to the program, I believe. I observed that occupational goals are not highly valued within the practice context, and I feel that if they were emphasised, this would lead to integrating this as part of the treatment plan more. Treatment sessions would grow in a way that prioritise using occupation as a means to an end. Hopefully this practice will head towards this in the future. Thank you.